I wanted to be a pharmacist because when I turned 16 and I needed a job, I became a pharmacy technician at a local independent pharmacy and fell in love with it. And so that kind of set the trajectory of my career in the pharmacy path. I think one of the major reasons why even at 16 I kind of understood that pharmacy was something I wanted to be a part of was because for the first time it turned my zip code, just kind of like this arbitrary zip code number, into a community. So people that were coming into the pharmacy, I was seeing them in their grocery store, and I was seeing them on our bike trail, and I was seeing them everywhere, and it kind of made my zip code turn into this more community-oriented, small town feel, and I really liked that. And so, in addition to a million other reasons why I would argue that I'm a pharmacist today, that is the main reason when I was 16 that I decided, hey, maybe this is something I want to get involved with long term. So I think one of the most unexpected and memorable patients that I've had in my short career has been my mom. She was diagnosed with early onset Alzheimer's last year, and I was still in school, so I wasn't as able to be involved as I am now that I'm home with her. But I remember I came back every once in a while to visit parents, as one does in college, and I remember seeing her drug regimen. And at this point, I was late in school, so I kind of had like a knowledge base already of pharmacotherapy. And I saw that she was taking Aricept and then also oxybutynin, which is a drug interaction. And I know her personally, so I knew that she definitely did not need oxybutynin at all. My mom, who was seeing all these different doctors at once, getting all these different drugs, no one was talking to each other. And I just had come home for the weekend to spend time with my parents from college. So that Monday, in between classes, I called each prescriber, each doctor, and kind of like let them know what was going on with her, who was prescribing what, and the drug interactions that were occurring. And so, long story short, we were able to switch her to, we'll get her completely off the oxybutynin, and she's still off of that today, which I'm very, very happy about. And then switch her to a different antidepressant agent that wasn't, you know, as dangerous, I guess, in her condition. And so, yeah, so it turned out to be a real success story, and I think that was the first time when I realized that it was a really good decision to go into pharmacy school, because not only am I able to impact patients that are coming in to my pharmacy, but it really hit home at that point. I realized that I can make a difference whether it's at work or after work. And so I feel like pharmacy is something that I do every day, all day, you know, whether I'm working or whether I'm at home with my mom. And so I'm very, very grateful that I chose this career path, and that was one of the most defining moments in my life when I realized, okay, this is a good thing. This is a good place to be. Pharmacists deserve provider status because we are uniquely placed within the community in order to build relationships, very long-term relationships with patients. We're not just seeing them on scheduled appointments. We are seeing them monthly, if not more than monthly, because if you think about it, they're coming in at least once a month, once every 3 months to pick up medication. But then in between then, I mean, if they have a daughter that gets sick and she needs, you know, some sort of cough or cold medication, if, you know, the allergies are kicking in and they come in for that, if they're in pain and they need ibuprofen. So you're actually seeing patients on a really frequent basis, and I think that that's unique to community pharmacy. So what that frequency does is it allows you to build a rapport with patients over time in a manner that I think is different from other healthcare provider situations.